Rheumatoid arthritis in its own right is a very nasty disease, but due to the work of Dr. Ferdous, we've now learned that rheumatoid arthritis is a major risk factor for cardiovascular disease. That's really important because rheumatoid arthritis can strike young people down and affect people in the 20s, 30s, 40s. If during that time for the rest of their life they're all going to have this extra risk for cardiovascular disease, the risk of heart attack, of stroke, of heart failure are going to be really high. So if we can understand that that's the case, it's really important because we need to look carefully for it, we need to treat it, we need to stop these people getting the cardiovascular disease. It's only by understanding what the problem is, like we've learnt from Dr. Ferdous's work, that we can really start as physicians to address it, and importantly for the public and for patients to understand that rheumatoid arthritis is a bad disease. It doesn't only affect the joints, it can cause heart disease. Go and see a rheumatologist and get proper treatment. So rheumatoid arthritis is more prevalent in females rather than males. We don't fully understand that, but we think it's due to hormones, because once women have gone through the menopause, their chance of getting rheumatoid arthritis drops to be broadly similar as men. And also, when women are pregnant, rheumatoid arthritis tends to get better. So though we don't know for sure, we think it's the effect of hormones, which in this case is a bad thing for the women. For sex differences, so whenever we're doing a study, we've got to be careful that we're not having lots of confounders. There might be something very different explaining the result. So in this research, there's been a very painstaking attempt to actually try and control for as many things as possible and analyse the data to look at things in a totally independent way. So we can be confident it's not just a matter of being female that's the problem, it's actually having the rheumatoid arthritis, which of course, if you're female, you're more likely to have rheumatoid arthritis, and that can help weight things a little bit. I think the prevalence of rheumatoid arthritis is broadly similar in India than it is in Western Europe and North America. So it's not that there's more or less people with rheumatoid arthritis. It seems to be that in Indian patients, the risk of rheumatoid arthritis causing heart disease is much higher. Now, we don't know why. It could be due to genes, it could be due to the environment, it could be due to the biryanis in Hyderabad. We really don't know. And clearly, we need to try and understand that. But at the end of the day, the important thing is if we detect problems like hypertension, like diabetes, like overweight, if we can modify those, that will also cut down the risk of cardiovascular disease. So there's a lot that patients can do to get themselves better. Rheumatoid arthritis can affect anybody from the age of about 1 year old, with a childhood equivalent of rheumatoid arthritis, to somebody in the 80s. Any age can get it, but it usually tends to start around the 20s, and it's probably the most prevalent between people who are 30 years old and 50 years old. I think there's a number of things of advice I give to Indian people with rheumatoid arthritis. The first is, remember that this can be a bad condition and it needs proper expert treatment. So go and see a rheumatologist. That's very important because these are the real experts for treating it. The second thing is, if you have rheumatoid arthritis, be careful not to get overweight, get your blood pressure checked regularly and get your lipids checked, because these need to be corrected if they're high, because if you can correct them and if your rheumatoid is treated properly, you should have no extra risk compared to anybody else. So there's a lot to play for. I think in the future what we want to try and do is understand this a little bit more, exactly what's causing this increased risk and can we actually try and prevent that in the first place. But these are things that we need to learn for the future. Thank you.